Have you ever been told you're just a little overweight, but everything else looks fine? This video is for you, my friend, because sometimes what looks fine isn't. Today, we are talking about how even mild weight gain, especially belly fat, can be a warning sign for something much bigger. Because you know what? Belly fat is a silent setup for heart attack or a stroke. But here's the good news. There are lab tests that can reveal your risk early before disaster strikes. Let me tell you how I use these tests in my clinic to uncover the hidden risk, even in patients who think they are mostly healthy. So I had a patient, 42 years old, worked in finance, played tennis on the weekend, and he didn't think he was unhealthy. Even his BMI is 28. His waist size was 42 inches. We did routine labs and they were all normal, but something didn't sit right with me. He said, "Doc, I just get tired easily after meals and I have gained about 10 pounds over the past couple of years." So I ordered a deeper set of labs, and what we found shocked him. So as you know by now, BMI is a blunt tool. It doesn't measure where your fat is, and that matters a lot. A normal BMI with excess visceral fat, which is called the belly fat, carries a higher risk than someone who is technically obese but metabolically healthy. Why? Because this belly fat acts like an endocrine organ, pumps out inflammatory signals that damage your arteries and increase blood clotting. These are the key labs I use to assess risk for heart attack and stroke early. Let's start with number 1, fasting insulin and HOMA-IR, hemostatic model assessment insulin resistance. Tells you how hard your body is working to keep your blood sugar normal. If you have high insulin, that means early insulin resistance. That means higher cardiovascular risk. Number 2, high sensitivity CRP, C-reactive protein. This is a marker for chronic inflammation, and that predicts future heart events even if your cholesterol is normal. Number 3 is ApoB, more accurate than LDL cholesterol. High ApoB means you have more atherogenic particles damaging your arteries. Number 4, Lipoprotein a, a genetic risk marker. Elevated Lp(a) is a silent risk factor for early heart attacks and strokes, and is easily missed by routine cholesterol testing. Number 5 is triglyceride to HDL ratio. This is a marker of metabolic health. If it's more than 2, that means insulin resistance and higher risk of plaque buildup. Number 6 is ALT and AST. These are liver enzymes. They get elevated with fatty liver, which is a silent predictor of both diabetes and cardiovascular disease. Lastly, 7 is fasting glucose and A1C. Still useful, but alone they miss early dysfunction. Just like in diabetes, visceral fat promotes plaque formation in arteries, elevated blood pressure, increased blood clot risk, and disrupt lipid metabolism. That's why 75% of heart attacks occur in people with normal LDL. You know why? Because their inflammation and insulin resistance went unchecked. If the labs are concerning, I may order these as imaging tools. First is coronary artery calcium score to detect early plaque, and also I will accompany that with liver ultrasound to assess for non-alcoholic fatty liver disease. These are not routine, but they can catch disease before symptoms appear. So back to my patient. We did labs showing high fasting insulin, and its HOMA-IR was elevated 5.3, and his high sensitivity C-reactive protein was very high, along with triglyceride. HDL was 38, but his ratio was more than 5. And he has elevated ALT and AST, which indicates fatty liver. So this patient has no chest pain, no symptoms whatsoever, but inside his arteries are under attack. So we built a plan. First, cleaned up his carbs, focusing on fiber, healthy fat, and protein. Number 2, daily 30-minute walks plus resistance training 3 times a week. Number 3, added magnesium and omega-3. Number 4, prioritize sleep and reduce alcohol. At 6 months, his waist dropped down 3 inches, his A1C dropped down to 5.3, his triglyceride went down to normal to 120, and his high sensitivity C-reactive protein went down. He felt better than he had in years, and his risk dropped before ever needed medications. Are you wondering if this could be you? Here are signs you should get tested. Number 1, waist size more than 40 inches in men and 35 inches in women. 2, fatigue after meals or sugar crashes. 3, A1C between 5.6 to 6.4. 4, low HDL and high triglyceride. 5 is a strong family history of heart attack or stroke. And 6 is history of gestational diabetes, PCOS, or fatty liver. You don't need to wait until something breaks. With the right labs, we can see it coming. Here is the bottom line. Number 1, a normal BMI doesn't mean low risk. Number 2, visceral fat and insulin resistance silently fuel heart disease and stroke. Number 3, early labs can give you the power to change course before symptoms ever show up. Here at Dr. Nony's Power Lab, we make the invisible visible. So if this helped you, please like this video, subscribe for more no-fluff medical deep dives, and drop a comment below. Have you had any of these tests? What changes have helped you? Let's outsmart disease and protect the heart that keeps us going. Thank you and have a great day. Bye-bye.